Good day everybody, my name is Brianna Cheesy and today we're going to talk about peptic ulcer disease. Before we continue, please make sure you're subscribed to this channel. Click the subscribe button and subscribe now. Alright, back to our topic, peptic ulcer disease. Now, peptic ulcer disease refers to a condition, a disease where sores or ulcers, that means wounds, develop in the lining of the stomach, gastric ulcers. And the word peptic means stomach and the word ulcers means breakage or sores or wounds. So in general, we can see the peptic ulcer disease is when there is wounds in the linings of the stomach or when there's breakage in the lining of the stomach. So normally what causes the peptic ulcer disease is, number one, we have the H. pylori infection. H. pylori stands for Helicobacter pylori. And number two, we have the prolonged use of non-steroidal anti-inflammatory drugs known as NSAIDs. So prolonged use of NSAIDs can cause peptic ulcer disease. Then we also have acid production in the stomach. Excessive production of acid in the stomach can erode the stomach lining, thereby leading to having peptic ulcer disease, thereby causing peptic ulcer disease. Then the last one, we have genetic predisposition. Now, family history can also play a major role in causing ulcer. Now, I have had a lot of people saying that stress can cause peptic ulcer, but let me say something. Let me clarify something. Stress does not cause peptic ulcer disease. Stress only puts you in a place, or stress only, let me say, it aggravates your ulcer pain. It wasn't the ulcer pain, but it does not cause peptic ulcer. So let's move on to the symptoms of peptic ulcer disease. So talking about the symptoms of peptic ulcer disease, I think the most common symptoms a lot of people have and a lot of people complain is chest pain. You hear somebody saying he has or she has chest pain. Now, chest pain is the most common symptoms of peptic ulcer. While some, the pain can be in the abdominal pain, while some, the pain can be at the rib side. Some complain feeling pain at their ribs, side of their ribs, and then some, the pain can be at the back. So all these are the commonest symptoms and signs of peptic ulcer. Then we have nausea, vomiting. Some feeling nausea and then vomiting. Then you may see sometimes the person vomiting blood or having a dark color too in severe cases. So all these are symptoms of peptic ulcer disease. So there is also loss of appetite, and then this loss of appetite can be caused due to abdominal pain. The abdominal pain can lead to decreased appetite, and then when a person has decreased appetite, he tends not to eat as expected, and so the person will begin to experience weight loss, unintentional weight loss as a result of the loss of appetite. Then the last one, we have bloating and gas. All these are symptoms of ulcer disease, peptic ulcer disease. So lack of proper treatment of ulcer or failure to treat your ulcer can lead to several complications. There are many complications attached to not treating your peptic ulcer disease. Number one complication is bleeding. Remember, we say ulcer is wound in the lining of the stomach. That means it's a sore, a breakage in the lining of the stomach. So if there's a wound, and blood can come out from that wound. So there can be internal bleeding, which in severe cases can lead to even shock or can lead to other severe complications such as anemia or even death. So bleeding is a complication of peptic ulcer disease when you fail to treat. And then also we have perforation. Ulcers can perforate their intestinal walls, which will eventually lead to peritonitis. So the last but not the least is gastric cancer. One will be at risk for gastric cancer due to the H. pylori infection. The H. pylori infection can put one at risk for gastric cancer. So gastric cancer is also part of the complication, and there are so many more complications that may occur when you fail to treat your peptic ulcer disease. So advisedly, when you are experiencing peptic ulcer disease or when you feel these symptoms mentioned above, you're supposed to see the doctor or you're supposed to visit the hospital for proper. So talking about the treatment of peptic ulcer disease, I think the most first and important treatment is lifestyle modification. Now, lifestyle modification is very important in the treatment of peptic ulcer disease. You have to avoid smoking because smoking can be a contributing factor to having a risk factor, can put you at risk for having peptic ulcer disease. So avoid smoking, reduce stress, avoid taking NSAIDs, such as example of NSAID is ibuprofen. Some of you are small pain, ibuprofen. So prolonged use of that ibuprofen can put you at risk for having peptic ulcer disease. Reduce stress and also eat balanced diet and eat at the appropriate time. Then number 2, drug treatment of peptic ulcer disease. You can start from antibiotics, very essential in the treatment of peptic ulcer disease. And we also have the use of PPIs. PPI stands for proton pump inhibitors. An example of PPIs, we have omeprazole, rabeprazole, esomeprazole, lansoprazole, and so on. Then we have the use of the H2 blockers. The H2 blockers, we have drugs like cimetidine, ranitidine, famotidine, and so on. Then you can also use antacids, which are very essential also in the treatment of peptic ulcer disease. Example of antacid, we have MMTs, mixed magnesium trisilicate, we have them gestates, all these drugs that look like pain, so you know them. So with this, we have come to the end of this video. Please let me know if you are finding this video interesting. Please, and don't forget to subscribe to our YouTube channel and also follow us on Facebook, on TikTok, and on Instagram. Please click the share button.